Top 3 foods to reduce back pain in seniors. Strengthen your back. Do you wake up in the morning with pain in your back? As if someone had been pulling on your spine all night? Turning over is hard, and getting out of bed is even harder. As we age, muscles weaken, flexibility decreases, and even simple movements become a challenge. In today's video, we'll reveal 3 superfoods that help older adults maintain strong muscles and keep their backs in good condition. So stick around because you don't want to miss these life-changing nutrition tips. Before we started, I'd like to know how you got here today. Drop a comment and feel free to ask any questions you have. And don't forget to hit the subscribe button and turn on notifications so you never miss life-changing tips. Number 1, salmon. Salmon is not just any fish. It's a natural helper for health, especially in old age. Unlike many other fish, it contains 3 essential elements for muscle and nerve function: omega-3 fatty acids, vitamin D, and high-quality protein. First, omega-3s are special fats that the body doesn't produce on its own. They must be obtained from food. Omega-3s reduce inflammation, strengthen blood vessels, and nourish nerve endings, which are responsible for movement and sensation, especially important when muscles weaken with age. Second, salmon is one of the few natural food sources of vitamin D, which is critical for healthy muscle function. Its deficiency is common among older people, especially during winter. Third, salmon contains high-quality animal protein, which helps maintain muscle mass. After 60, muscles naturally weaken. Without the right fuel, people lose strength and stability and become more prone to cramps. In short, salmon isn't just food, it's a natural medical kit for muscles and nerves. How do omega-3 fatty acids reduce inflammation in muscles and joints? As people age, many notice muscle pain even without physical exertion, stiff joints in the morning, and even nighttime leg cramps. These symptoms are often linked to chronic inflammation, internal tissue irritation that builds up over the years. This is where omega-3 fatty acids from salmon step in. These natural compounds help calm inflammation. They gently but effectively slow the action of certain substances, like cytokines, that trigger inflammation in muscles, joints, and nerves. When inflammation subsides, muscles work more efficiently, become more flexible, and joints move more freely. This means less pain, less morning stiffness, and fewer nighttime spasms in the calves or thighs. Omega-3s also boost circulation, helping nutrients reach muscles more effectively, speeding up tissue repair, especially after injury, surgery, or age-related wear and tear. Why is vitamin D from salmon especially important for nighttime cramps and muscle weakness? Vitamin D is not just a sunshine vitamin. It plays a key role in nerve function and muscle contraction. Deficiency is one of the most common causes of nighttime cramps in older adults. When there isn't enough vitamin D, muscles become sluggish and weak, don't respond well to nerve signals, which can lead to sudden cramps, especially in the calves, numbness, and even unstable gait. Why is salmon so helpful? Because it contains vitamin D3, the most easily absorbed form. This is especially important for those who rarely go outside, live in northern areas, or take medications that interfere with vitamin absorption. Eating salmon regularly helps restore vitamin D levels naturally, without supplements, and reduce the frequency and severity of nighttime muscle spasms. Does regular salmon consumption affect pain levels or cramp frequency? Yes, and it's supported by research. People over 60 who eat salmon at least twice a week often notice significant improvements in muscle and joint health within just 3 to 4 weeks. Here's how it helps. Cramps become less frequent thanks to increased vitamin D, magnesium, and omega-3s. Pain intensity drops, especially for those with chronic inflammation, arthritis, or tired legs. Omega-3s act as a gentle lubricant for joints and muscles. Energy and strength improve. When muscles get the protein, fats, and vitamins they need, they become stronger and more resilient, making it easier to get out of bed, climb stairs, or go for a walk. Salmon is already powerful, but its effects can be enhanced by combining it with other healthy foods. Salmon plus spinach or broccoli, rich in magnesium and potassium, which are crucial for preventing cramps. Salmon plus eggs. Eggs provide more vitamin D and good protein, making a great combo for muscle repair. Salmon plus lemon juice. The acidity helps the body absorb minerals and iron more efficiently, plus it's tasty. For maximum benefit, steam, bake, or simmer your salmon. Avoid frying in oil, which can destroy nutrients. Is salmon safe for people with high cholesterol or cardiovascular disease? Many people worry about fat and cholesterol, and rightfully so. But not all fats are bad. Salmon contains healthy, unsaturated fats which lower bad, LDL, cholesterol, raise good, HDL, cholesterol, support blood vessel flexibility, and reduce the risk of strokes and heart attacks. Omega-3 fatty acids in salmon. Thin the blood, lower inflammation in arteries, reduce blood pressure, and help prevent dangerous blood clots. That's why salmon is one of the few fatty foods doctors recommend even for people with high cholesterol or heart disease. Just remember, stick to 2 to 3 servings per week and choose wild or fresh salmon, not highly processed or canned varieties with additives. Second, let's talk about bone broth. What components in bone broth help strengthen joints and muscles in older adults? Bone broth isn't just a warm dish. It's a healing elixir for joints and muscles, especially in older age. When you slowly simmer bones with cartilage for several hours, they release collagen, gelatin, amino acids, minerals like calcium, magnesium, and phosphorus, and even a bit of healthy fat. Collagen is the main protein that makes up our joints, ligaments, and skin. As we age, collagen production decreases and joints become dry and stiff. Broth helps replenish this loss naturally. Gelatin is essentially dissolved collagen. It improves joint mobility and reduces morning stiffness. Amino acids like glycine, proline, and glutamine support muscle recovery, help fight fatigue, and even improve sleep. Minerals like calcium and magnesium are essential for proper muscle function, bone strength, and cramp prevention. So bone broth is a gentle, natural way to nourish tissues and restore flexibility. How do amino acids from broth affect tissue repair and cramp prevention? Amino acids are the building blocks of all tissues: muscles, skin, blood vessels, and even nerves. Bone broth contains several key amino acids in a form that's easy to absorb, even for people with weak digestion. Glycine repairs muscle fibers, especially after exertion or cramps. It also calms the nervous system, improving sleep and relaxation. Proline and hydroxyproline support the repair of ligaments and tendons, especially helpful in arthritis or joint inflammation. Glutamine boosts immunity and helps rebuild muscle cells after damage. If someone experiences frequent night cramps, it could be due to a lack of amino acids and minerals. Bone broth helps replenish these gently and effectively without overloading the stomach or liver. How important are calcium and magnesium from bone broth for proper muscle function? Muscles can't function properly without 2 major minerals, calcium and magnesium. These minerals regulate how muscles contract and relax. If they're lacking, it can lead to cramps, twitches, tiredness, and even weakness. Calcium acts like a key that triggers muscle contraction. Magnesium helps the muscle relax afterward. Without enough magnesium, muscles can get stuck in contraction. That's how cramps happen. Bone broth, especially when cooked for 6+ hours, becomes a rich source of these minerals in a highly absorbable form, ideal for seniors whose digestive systems may not extract minerals well from tablets. It's also useful for those taking medications like diuretics or antacids, which often deplete calcium and magnesium. Can regular bone broth reduce nighttime muscle spasms? Yes, and this is confirmed by both doctors and patients. Drinking bone broth regularly, 3 to 5 times per week, can significantly reduce the frequency and severity of nighttime leg cramps, especially for people over 60. Here's how it works. Amino acids strengthen and repair muscle tissue. Collagen and gelatin nourish tendons and ligaments, making them more flexible. Minerals, magnesium, calcium, support healthy nerve and muscle function, eliminating the root causes of cramps. Many older adults who drink bone broth regularly notice fewer cramps, more relaxed muscles, better sleep, and less stiffness in the morning. It's particularly effective for those whose cramps are linked to muscle fatigue, dehydration, or general weakness. When is the best time of day to drink bone broth for the best effect? The best time to enjoy bone broth is in the evening, about 1 to 2 hours before bed. At this time, broth relaxes the muscles and nervous system, warms the body, prepares the body for rest, and relieves fatigue accumulated during the day. You can even add garlic or turmeric for a stronger healing effect. If someone has a poor appetite in the morning, broth can be a great replacement for tea or coffee, especially with a pinch of salt or herbs. It gently warms the stomach and starts the metabolism. Important: drink warm, not scalding, broth. Don't drink it on an empty stomach if you have gastritis or ulcers. Add a small slice of bread, toast, or a boiled egg. It makes a perfect light, nourishing meal. Can bone broth replace collagen, glucosamine, or other joint supplements? In many cases, yes. Bone broth can be a natural, affordable, and safer alternative to popular supplements like collagen powder, glucosamine, or chondroitin. Here's why. It contains natural collagen and gelatin, not synthetic. It's free from chemicals and preservatives. It's better absorbed because it comes in warm, liquid form, and it's cheaper and tastier than many store-bought pills. Of course, for serious joint problems, your doctor may still recommend additional support. But if your symptoms are mild, occasional stiffness, minor cramps, or cracking joints, bone broth is an excellent first step for prevention. Combine it with light physical activity, massage, and proper hydration, and you'll notice gentle, lasting improvements. 3. Turmeric. How does turmeric reduce inflammation in muscles and joints? Turmeric isn't just a kitchen spice. It's a powerful natural remedy that's been used in traditional medicine for thousands of years, especially to relieve inflammation and pain. Its key active compound is curcumin. Curcumin works similarly to over-the-counter anti-inflammatory drugs like ibuprofen, but without the harsh side effects on the stomach or kidneys. It blocks enzymes that trigger inflammation, such as COX2 and TNF-alpha. As a result, joint swelling goes down, aching and pulling muscle pain eases, and mobility and flexibility improve. This is especially important for seniors because inflammation is a common cause of morning stiffness, back or knee pain, and even muscle weakness. Is there evidence that curcumin can reduce cramps or muscle pain? Yes, modern research confirms that curcumin has a positive effect on muscle health and pain relief. It's particularly helpful for people with chronic inflammation, fibromyalgia, or arthritis. While curcumin doesn't directly affect nerve signals, it helps to reduce inflammation around the nerves, which may trigger muscle spasms, lower muscle sensitivity to pain, improve sleep quality, which also helps reduce cramping at night. Curcumin also reduces oxidative stress, the buildup of toxic byproducts in muscles after physical effort or emotional stress. These toxins can cause burning pain and that tight muscle feeling. For people over 60, especially women, taking turmeric regularly can be a gentle and natural way to prevent cramps and muscle aches. How does turmeric support blood circulation and recovery after physical activity? Curcumin has a mild vasodilating effect, meaning it helps blood vessels widen slightly. This improves circulation, especially in tiny capillaries that feed muscles, joints, and ligaments. After even light physical activity, a walk, stretching, or gardening, muscles need time and nutrients to recover. Curcumin helps by reducing post-exercise inflammation, speeding up oxygen and nutrient delivery to tissues, and lessening soreness and fatigue. This is especially helpful for seniors because blood flow to muscles slows with age, making recovery slower and more difficult. Turmeric is a perfect natural addition to a gentle exercise or rehab routine. What foods boost turmeric's absorption, e.g. black pepper? Curcumin by itself is poorly absorbed by the body, but when you combine it with the right foods, its effects increase dramatically. Here's how to boost it. With black pepper, it contains piperine, a natural compound that increases curcumin absorption by up to 2,000%. Just a pinch of pepper in a dish with turmeric makes a huge difference. With fats, curcumin is fat-soluble, so it's best absorbed with oil, ghee, coconut milk, or even broth. Turmeric in soup or warm milk with butter is excellent. With warm liquids, a popular recipe is golden milk. Warm milk with turmeric, black pepper, and a bit of honey, perfect before bed. When paired well, turmeric becomes a delicious and highly effective natural remedy. Generally, turmeric is safe for most older adults, especially when used as a spice or in small amounts, like 1 to 2 times per day in meals or drinks. But here are a few important points. People with gallstones or bile duct problems should avoid large doses, as turmeric can stimulate bile flow. If you're taking blood-thinning medications, like warfarin or aspirin, turmeric may enhance their effect, so consult your doctor. Those with gastritis or ulcers shouldn't take turmeric on an empty stomach. It may cause irritation. Otherwise, 1/2 to 1 teaspoon per day with food is safe, tasty, and highly beneficial, especially for chronic pain and stiffness. Can turmeric replace anti-inflammatory medications, NSAIDs? In many cases, yes, especially for long-term use. Pharmacy painkillers like ibuprofen or diclofenac are effective but can irritate the stomach, strain the liver and kidneys, and raise blood pressure, particularly in seniors. Turmeric works gently and gradually, but much more safely. You can use it for chronic inflammation, like arthritis or osteoarthritis, to reduce pain and stiffness, or as preventive support after physical exertion. That said, turmeric won't replace strong drugs during an acute flare-up or injury, but with regular use, it can significantly reduce your need for painkillers, especially for chronic conditions. Best approach? Combine turmeric with movement, stretching, hydration, and rest, and let your body heal naturally without relying on extra pills.